Hello, beautiful souls, and welcome back to our channel, where we explore the world of caregiving and senior health with love, empathy, and a dash of realness. I'm Rosalie, your host, and whether you're tuning in as a caregiver, a loved one, or someone who's navigating their own health journey, I'm so glad you're here. Today, we're diving into a topic that's close to the hearts of so many of us: senior health. Now, we all know that aging comes with its own set of challenges: physical, emotional, and even spiritual. And sometimes, as caregivers, it feels like we're carrying the weight of those changes on our shoulders, doesn't it? But here's the good news. We're doing this together, and more importantly, there are real practical ways to support our aging loved ones while keeping ourselves grounded. In this episode, we're going to explore some of the most common health concerns that our seniors face, from why they might be resistant to seeing a doctor, to those sneaky conditions that can go unnoticed but make a huge impact on their quality of life. Along the way, I'll share some stories and tips that will hopefully inspire you and maybe even give you a new perspective. So grab a cup of tea, take a deep breath, and let's walk this path of understanding together. Okay, let's be real here, friends. You've probably been in a situation where you know something's not quite right with your parent or spouse, but the moment you take them to the doctor, it's like they're auditioning for a Broadway play. They suddenly perk up, become charming, and of course, tell the doctor that everything is just fine. We call this show timing, and trust me, there are many others in facing this frustrating scenario. I've been there myself. It's hard to know what to do when the person you love won't open up about what's really going on with their health, especially when it's crucial for their well-being. But why do they do this? Well, there are a few reasons. One of the main reasons our loved ones put on this performance is fear. Fear of what the doctor might say. Imagine being in their shoes. A diagnosis of something like heart disease, dementia, or cancer can feel like the end of independence. They worry that a serious diagnosis might mean losing the freedom they hold onto, whether it's driving, living on their own, or just maintaining a sense of control. So they brush off their symptoms to avoid facing that scary reality. Another reason? Embarrassment. Think about it. No one likes to admit they're struggling, especially when it comes to their health. Our elders grew up in a time when doctors were seen as authoritative figures, and admitting to weakness could feel shameful. Some seniors are also in denial, clinging to the idea that if the doctor says they're fine, then they must be. It's easier to convince themselves, and sometimes the doctor, that everything's okay. For those dealing with memory problems or early dementia, this denial can be even more complex. In some cases, it's not that they're deliberately hiding things, but rather they truly don't recognize their symptoms because of conditions like anosognosia, which means they're unaware of their own cognitive decline. So, when they're in that doctor's office, they genuinely believe there's nothing wrong. So, how do we handle this without undermining their dignity? First and foremost, you need to be your loved one's advocate. I know this can be tricky. You want to help, but you also don't want to make them feel like they're losing control over their own health. Here are a few things you can do. Before the appointment, if possible, speak to the doctor one-on-one. Let them know what's really going on, whether it's memory issues, physical pain, or behavioral changes, because your loved one might not admit it. This conversation can happen over the phone or in person, and it helps give the doctor a fuller picture before they even see the patient. Another option is to send a letter or email outlining your concerns. That way, the doctor can bring up certain topics during the appointment without your loved one feeling blindsided or embarrassed in front of you. Keeping a diary of symptoms and behaviors is incredibly helpful. You can jot down any patterns you notice over a week or two and bring that to the doctor. It's a way to present factual information without putting your loved one on the spot during the appointment. One simple yet important tip is to bring a complete list of your loved one's medications. This helps the doctor ensure there are no dangerous drug interactions or unnecessary prescriptions. Lastly, and this is key, keep your loved one involved. It's easy to take over the conversation during the appointment, especially when they're not being fully honest. But we have to remember, they are adults and deserve to be treated with dignity. So, while you can support them by speaking up or taking notes, make sure the doctor still addresses your loved one directly. This balance can be tricky, but it's so important for preserving trust. At the end of the day, it's about finding that middle ground between advocating for the care your loved one needs and helping them maintain a sense of control and dignity. It's not easy, but with the right approach, we can work through these moments with love, compassion, and a little bit of strategy. Now, if this sounds familiar to you, you're not alone. Many caregivers face this same struggle of trying to get doctors to see what's really going on, while their loved one seems to magically perform in the exam room. It's so common, and I've heard from many people who've been in this exact situation. One caregiver shared a story about their mother, who had Alzheimer's. The caregiver emailed the doctor before the appointment to highlight memory issues and concerns about her mum wanting to drive, even though it wasn't safe. When the caregiver's mum found out, she said, "You must be in cahoots with the doctor." On top of that, she'd tell the doctor everything was fine, all while coming up with strange stories at home, like accusing people of stealing her coffee. Alzheimer's, as we know, can bring out unpredictable behaviors, but it's that fear of losing independence that often leads them to deny the reality of their symptoms. Another listener talked about her husband, who would always act completely fine at the doctor's office, even when suffering from severe pain at home. After years of doctors brushing off her concerns, she decided to start videotaping him at home during his episodes of discomfort. When she showed the footage to the doctor, they finally took the symptoms seriously, leading to necessary tests and treatments. It took this creative approach for her husband to get the attention he needed. These personal stories reflect just how tricky it can be to bridge the gap between what you see as a caregiver and what the doctor sees in those short appointments. They also highlight some creative strategies, like writing ahead or even videotaping, that can really make a difference in ensuring your loved one gets the care they need. Okay, friends, here's a situation many of you are probably familiar with. You know your loved one needs to see a doctor, but they refuse to go. It's frustrating and anxiety-inducing, especially when their health seems to be declining. But why does this happen, and how can we navigate it with love and understanding? First, we have to acknowledge that aging can be terrifying for many reasons. Fear is often behind a senior's refusal to visit the doctor. Some are afraid of getting bad news, while others might feel embarrassed, or they just want to avoid further treatments that they find exhausting or overwhelming. This ignorance is bliss mindset can be hard to overcome, but it's important to remember that as much as we want to help, seniors who are mentally capable have the right to refuse care. That can be difficult to accept, but it's a fundamental part of their autonomy. Now, things get more complicated when we're dealing with a loved one who has dementia. Many people with dementia experience something called anosognosia, which means they're not even aware of their cognitive decline. It's not denial, they truly don't recognize the symptoms, making it even harder to convince them to see a doctor. So, what can you do? Well, sometimes you have to get a little creative. One approach is to involve their primary care physician. Ask them to help sell the idea of seeing a new specialist or trying a new treatment. Doctors often have a way of reassuring patients that makes a big difference. Another tactic is a gentle white lie. Tell them you're going out for lunch or to run errands, and on the way, stop by the doctor's office. "Oh, look, we're here, and guess what? The doctor has time to see us." This approach doesn't always work, but it's a compassionate way to handle a difficult situation. In the end, finding the right doctor, one who specializes in geriatrics and understands the emotional and physical complexities of aging, is key. It might take some trial and error, but the right fit can make all the difference in making those doctor visits a little easier for everyone. Now, I know some of you are out there thinking, this all sounds great, but my loved one absolutely refuses to go to the doctor no matter what I do. There are so many caregivers in this exact position, feeling frustrated and at their wits' end. Let me share a couple of stories that might sound familiar and hopefully help you feel less alone in this struggle. One listener shared how her mother, who suffers from heart problems, COPD, and a blood clot near her heart, simply refuses to go to the doctor. Despite the family's concerns, she won't take her medications unless she personally agrees with the diagnosis. She even hides her drinking habits, thinking her family doesn't notice. They feel completely powerless, watching her health decline, unsure of what to do next. It's heartbreaking, and many of us have been there, feeling like you're watching a slow train wreck you can't stop. Another listener tried something creative with her father. He'd refuse every doctor's appointment she made for him, so one day, she tricked him into going by saying they were going out for a haircut. On the way, she stopped at the doctor's office and told him they needed to check his blood pressure. Though he resisted at first, once they were inside, he went along with it. It took some creativity and patience, but it worked in the end. Sometimes we have to get a little inventive to help those we love. These stories remind us that every situation is different, but they also highlight how universal this challenge is. It's tough, but with a bit of patience and sometimes a clever workaround, you might just get them the care they need. Let's talk about something that's more common than you might think, yet often overlooked: urinary tract infections, or UTIs. Now, I know a UTI might not sound like a big deal, but in seniors, it can be a serious health issue. Left untreated, UTIs can lead to kidney infections or even sepsis, which is life-threatening. So, it's really important that we understand what to look for and how to prevent these infections in our aging loved ones. Older adults are more vulnerable to UTIs for a variety of reasons. As we age, our immune system weakens, making it harder to fight off infections. Things like incontinence, using catheters, or even conditions like diabetes can increase the risk. And ladies, especially, are more prone to these infections because their urethra is shorter, meaning bacteria have a shorter journey to the bladder. Now, the symptoms you might expect, like pain during urination, dark or cloudy urine, and the need to go frequently, aren't always what you'll see in seniors. In fact, older adults often experience lesser-known signs like sudden confusion, agitation, or even hallucinations. You might notice a change in their coordination or that they've started to fall more often. These changes can happen quickly and are sometimes mistaken for dementia, but they could actually be signs of a UTI. So what can we do? Prevention is key. Make sure your loved one drinks plenty of fluids, keeps the genital area clean and dry, and changes out of incontinence briefs frequently if they use them. If you suspect a UTI, don't wait. Get them to a doctor as soon as possible. A simple test can confirm if it's a UTI, and antibiotics can usually clear it up quickly if caught early. But be careful, not all bacteria in the urine need to be treated. Sometimes seniors have something called asymptomatic bacteriuria, where bacteria are present, but there are no symptoms. In these cases, antibiotics aren't needed and could even cause harm by promoting resistant bacteria. UTIs may sound simple, but they can have serious consequences for our elderly loved ones. Being aware and proactive can make all the difference. I hear from so many of you about how urinary tract infections, UTIs, have affected your loved ones. And let me tell you, it's not uncommon to see some heartbreaking changes in behavior when they strike. Let me share a few stories that may resonate with what you're experiencing. One caregiver shared the story of her 100-year-old mother who had been in good shape despite incontinence. When her mum began wearing adult briefs, UTIs became frequent. She noticed that when her mother started getting confused, forgetting where she was, or unable to string sentences together, it often meant a UTI was on the horizon. A simple over-the-counter UTI test helped catch the infection early. With some trial and error, they found a routine that reduced infections to just once a year. Cranberry capsules, moist toilet wipes used from front to back, and a raised toilet seat to help her mum maintain hygiene. Another story came from a woman whose 85-year-old mother, suffering from early dementia, moved into a nursing home. After a few weeks, her mom became withdrawn and angry, even hallucinating that her father, who passed away decades ago, had just left. A UTI was discovered and treated, but her mother's recovery wasn't quick. The daughter was torn. Every visit seemed to upset her mom more. The nurses reassured her that the changes were due to the UTI and the transition to the nursing home, but it didn't make it any easier to see her once lively mother so disconnected. She had never experienced a UTI impacting her mother's behavior so drastically before. Then, there's the story of a 90-year-old father, independent and full of life, who experienced a sudden decline after a simple hernia repair surgery. A urinary catheter had been placed for a few days, but no follow-up tests were done to check for infection. Weeks later, he fell and was rushed to the hospital with a brain bleed and a UTI. He never walked again. His family was left frustrated, feeling that their concerns about testing for a UTI after the catheter were dismissed by his doctors. These stories remind us that UTIs are more than just an inconvenience for our aging loved ones. They can lead to confusion, behavioral changes, and even life-threatening complications. Catching them early and maintaining proper hygiene can make a world of difference. Sepsis. It's a word you might not have heard, but it's a life-threatening condition that affects millions, especially older adults. Charles Summerall, a 54-year-old journalist, was one such person who barely survived it. He started with something as ordinary as a urinary tract infection, but soon his condition escalated. Within hours of being admitted to the hospital, his blood pressure plummeted, his kidneys began to fail, and he was in septic shock. A form of sepsis so severe that it could quickly turn fatal. But what exactly is sepsis? Simply put, it's an overwhelming response to an infection, where the body goes into overdrive trying to fight it off. Instead of just attacking the infection, the immune system starts damaging its own tissues and organs. It can begin from something as simple as a cut, a respiratory infection like pneumonia, or even a UTI, especially in older adults. Sepsis is common but rarely talked about. In fact, according to the CDC, over 1.7 million people in the US develop sepsis each year, and nearly 270,000 die from it. And while it's a risk for anyone, older adults are particularly vulnerable due to weakened immune systems and chronic conditions like diabetes or kidney disease. Even routine surgeries or the use of catheters can increase the risk. One of the challenges with sepsis is that its symptoms, such as fever, confusion, or rapid heart rate, are often mistaken for other conditions. This can delay treatment, which is critical because for every hour sepsis goes untreated, the risk of death increases significantly. The key to preventing and catching sepsis early is vigilance. Know the warning signs: a sudden change in mental state, extreme fatigue, or unusual pain. If these symptoms appear, especially after an infection, seek medical attention immediately and don't hesitate to advocate for your loved one. In the case of sepsis, time isn't just precious, it's life-saving. Rosalie talks in a warm and heartfelt voice. Sepsis is one of those silent dangers we often don't see coming until it's almost too late. Reading the stories people have shared makes this reality painfully clear. One heartbreaking story comes from an audience whose brother had an infection that no one saw coming. After caring for his elderly father, this man developed a severe infection that spread throughout his body, causing multiple abscesses in his brain. Despite seeing 3 doctors, the condition wasn't caught in time, and by the time they operated, it was too late. He passed away after battling pneumonia, sinus infections, and other complications. The family still wonders why no one caught the infection earlier, questioning whether it could have been prevented if someone had paid more attention. Another story is from a man who nearly lost his life after a routine procedure with his urologist. After a bladder-scope, he suddenly experienced chills, violent shaking, and a fever. Hours later, in the emergency room, he was diagnosed with an E. coli infection and sepsis. He admits he didn't realize how close he came to death and feels lucky to have received treatment in time. For him, sepsis was a wake-up call, making him grateful to be alive today. These personal experiences remind us that sepsis can strike unexpectedly. Whether it's a lingering UTI, a wound, or even a minor medical procedure, infections can escalate quickly, and sepsis can follow. The key is catching it early, before it becomes life-threatening. Being vigilant about symptoms, speaking up, and advocating for our loved ones can make all the difference in saving lives. Vitamin D might seem like a small thing, but for seniors, it's one of the most important nutrients to keep them healthy and feeling their best. As we age, it gets harder to get enough of this sunshine vitamin, and that can lead to all sorts of subtle but serious health problems. One of the biggest signs of vitamin D deficiency is weak muscles. For seniors, that can mean heavy legs, struggling to stand up, or having trouble climbing stairs. When muscles get weak and bones aren't as strong due to low vitamin D, the risk of falls and fractures goes up, and those can be life-threatening. Another sign is changes in mood and cognitive function. Vitamin D affects the brain in ways we're still learning about, but we know it helps regulate the release of important neurotransmitters like dopamine and serotonin, which are key to mood regulation. Low levels of vitamin D have been linked to depression, tiredness, and even cognitive decline, increasing the risk of conditions like Alzheimer's. So if someone you love seems down, tired all the time, or is struggling to focus, it could be a lack of vitamin D. A less obvious but important effect of low vitamin D is weight gain. This nutrient helps regulate hunger signals in the brain, and without enough, the body might not know when to stop eating. It's one of those hidden causes of weight gain that many seniors struggle with but don't always connect to their vitamin levels. Seniors might also feel a deep ongoing fatigue and widespread pain in areas like their shoulders, back and pelvis, often misinterpreted as just getting older. But vitamin D might be the missing piece here too. Finally, digestive issues can make things even more complicated. Conditions like inflammatory bowel disease can prevent the body from absorbing vitamin D properly, making deficiencies even worse. If you notice these signs in your loved one, don't wait. A simple blood test and perhaps a vitamin D supplement could make a world of difference in their health and energy levels. Vitamin D deficiency can quietly creep up on us, especially in older adults. But sometimes all it takes is a small change to make a big difference. Take Margaret, for example. Her mother, who was living with Alzheimer's, had started showing signs of weakness and fatigue. Margaret's first thought was that these symptoms were simply part of the Alzheimer's progression. But something felt off. After reading about the connection between vitamin D deficiency and cognitive decline, she asked her mother's doctor to run a simple test. Sure enough, her mum's vitamin D levels were low. After starting on a supplement, Margaret noticed her mother seemed more alert and physically stronger. It was a small victory, but a meaningful one in a journey that felt so out of control. Then there's Linda, whose family, like many, spent long winters indoors in Canada. Linda had always struggled with feeling low during those months, and it wasn't until a co-worker suggested sunshine in a bag, vitamin D lozenges, that she found relief. Linda's whole family started taking them, and soon enough they noticed fewer aches, less depression, and overall better energy. The trick was finding a simple, easy-to-take form of vitamin D that didn't add to the overwhelming list of daily pills her aging parents were already taking. Both of these stories remind us that sometimes the things we think are just part of aging could be our bodies trying to tell us something. Whether it's through a small supplement or just getting outside for a bit of sun, boosting vitamin D can make a difference in health and well-being. If your loved one seems more tired, weak, or mentally foggy, it could be worth looking into vitamin D levels. It's a quick and easy way to give them a boost. There's a moment that many of us dread when it becomes clear that our aging loved one's ability to drive safely may be slipping. But it's important to remember, age alone isn't the reason to take away someone's driving privileges. Instead, it's health conditions, medication effects, and physical changes that could make driving dangerous. If your loved one has been diagnosed with a new health issue or starts behaving nervously or recklessly behind the wheel, it may be time to reassess. Eye diseases like cataracts or macular degeneration can affect vision, but sometimes just adjusting when and how they drive can make a difference, like avoiding nighttime driving or addressing vision problems early. Hearing loss too can be a problem. If your loved one has trouble hearing horns or sirens, it's important to ensure they get regular hearing checks and use hearing aids if needed. Physical strength and mobility are often overlooked, but driving takes dexterity. If your loved one struggles with turning their head or managing the pedals, this could lead to accidents. Adjusting their car seat for better vision or encouraging light exercise to maintain their coordination can be small but meaningful changes. Chronic conditions like dementia or Parkinson's and medications that cause drowsiness or slow reaction times also play a major role. Conversations with their doctor can help clarify if and when it's time to hand over the keys. It's never an easy conversation, but approaching it with love and understanding while offering alternative transportation solutions can make all the difference in keeping your loved one safe. You know, sometimes it's not the hardest decisions themselves that weigh on us, it's the emotions wrapped around them. I've heard stories from caregivers who've gone through the painful process of taking away a loved one's car keys, and they remind me how deeply that sense of independence runs. One woman shared how, at 89 years old, her mother refused to stop driving, despite having macular degeneration. After numerous close calls and pleas from her family, they had to send a letter to the DMV. When her mother got the letter about taking a driving test, the accusations began, blaming the family for betraying her. It's heartbreaking, but the safety of everyone on the road was the priority. Another caregiver, a daughter, spoke about her father, a former professional driver. After a serious accident where he got lost and rear-ended another car, he was still insistent on driving. This daughter's pain came through as she described being the bad cop, constantly pushing back against his desire to get behind the wheel again. It's not that he was angry at her personally, she said. He was angry at losing control over his life. And honestly, who could blame him? But her resolve was clear. It was about his safety and the safety of others, even if it broke her heart to take away his independence. There's a strength in these caregivers that comes from love, a willingness to step in when it's needed most, even when it strains relationships. They find ways to stay compassionate, seeking solutions like driving courses or even using gentle, creative methods like a fake letter from the DMV to keep their loved ones off the road. It's not easy, but in the end, these decisions are about protecting the people we care for, even when it feels impossible. Next, I want to talk to you about something many caregivers experience, but often struggle with: hoarding. If your loved one has always saved things for a rainy day, those tendencies can intensify, especially if they're living with dementia. For someone with Alzheimer's, this behavior can become more than just keeping extra items around. It can become a way for them to cope with their anxiety and confusion. Think of a woman with dementia who starts collecting tissues because they bring her comfort. You might find tissues everywhere: pockets, purses, even hidden in strange places like the bathtub. What's happening is that she's looking for some control over her life as her mind becomes less reliable. Others may refuse to throw anything away, filling their homes with piles of old mail, trash, and objects they no longer need, creating unsafe living conditions. They might even start collecting things that don't belong to them, just trying to hold on to a sense of security and control in a world that feels increasingly chaotic. This kind of hoarding doesn't happen out of stubbornness or a desire to upset us. It's often a response to deep fears, confusion, or a need for reassurance. And the good news is that there are ways to gently manage these behaviors. One of the most effective strategies is to approach your loved one with kindness and patience. If they're hoarding something harmless, like tissues, it might be best to let it go for a while. But when the behavior threatens their safety, you might need to quietly remove some of the clutter or get them involved in other activities that can distract them from hoarding. Organizing a drawer or sorting photos together can be a helpful way to redirect their energy and give you both a chance to bond. Another idea is to create a memory box. This can be a designated space where they can safely store their treasures. You can decorate the box together, and it gives them a sense of control while keeping things contained. Remember, if their hoarding gets out of hand, there's no shame in asking for help. Speak to their doctor, who might recommend medications to reduce anxiety or compulsive behaviors. Patience and creativity are essential here, as is finding ways to keep your sense of humor. After all, the goal is to help your loved one feel safe, even in a world that's becoming harder for them to navigate. I've been hearing so many stories, and I think we must know that we aren't alone in this struggle. One woman shared how her mum, who had survived 3 strokes and a battle with cancer, had always been a minimalist until she married someone difficult. That's when the hoarding began. She's her mother's only child, and while she doesn't see their relationship as healthy, she is there for her. Now her mum's house is filled to the brim with items she refuses to throw away. 3 storage units full of things on top of that. It's hard for her to be around her mum sometimes, and I know that feeling. You care so much, but the weight of the situation can be overwhelming. Another caregiver described how a professional organizer had once helped clean up her mother's space, but it filled her mother with so much anxiety that the effort seemed to backfire. Her mum clings to everything, even junk mail, as if it helps her remember things. Now, every attempt to tidy up sends her mum spiraling into anxiety about losing control, fixating on a few missing dollars, and searching for receipts at all hours of the night. She's worried that the cleanup process could do more harm than good, and she's right to be cautious. There's also the story of a woman's aunt who, despite being moved into an independent living facility, continues hoarding in unexpected ways. She would dry out her wet diapers to reuse them. Even though they've tried to reason with her, she continues the behavior, which makes the environment smell unpleasant. It's not easy, and these are the challenges that aren't often talked about. Then, there's a man who takes care of his wife, a mild hoarder. He shared how her behavior began affecting him emotionally and physically, pulling him away from his own healthy habits until he reached out for help. They're both working toward recovery now, but he realizes that his wife's hoarding wasn't just her burden, it became his too. These are just a few of the many stories out there, but what they all have in common is the deep love and frustration that comes with caring for someone who hoards, especially when dementia is involved. You're doing your best to manage it all, but sometimes it feels like you're fighting a battle you can't win. Yet here we are, supporting each other and sharing our struggles. It's okay to feel overwhelmed. It's a lot. But together we can find a way through. One of the more challenging parts of caring for our elders is dealing with their repetitive behavior. Whether it's repeating stories, questions, or even simple statements, it can really wear down your patience over time. But when you understand why this happens, especially in the context of aging or dementia, it becomes easier to manage. First, we have to remember that repeating stories can be a way for elders to process their past. They're often reflecting on their lives, trying to make sense of their experiences, and perhaps leaving a legacy through these retold memories. We need to understand that recounting old stories can be their way of making peace with the past. So, even if you've heard the same story 100 times, try to be patient. Let them talk because it's important to them, and in many cases it's not harmful. When dementia comes into play, though, the repetition can become much more intense. Dementia patients might ask the same question over and over because their short-term memory is affected. For caregivers, this can be deeply frustrating, especially when you've answered the same questions several times in a matter of minutes. But it's important to remember that they aren't doing this to annoy you. It's simply that they can't help it. Their brain is damaged, and they're likely looking for comfort or clarity in a world that no longer makes sense to them. What can you do when this happens? A few strategies can help. The first is validation. This doesn't mean agreeing with something that's clearly untrue, but it does mean acknowledging their feelings and responding with empathy. For example, if they believe something unusual, like the grass being blue, it's not worth arguing about. You can say something like, "Yes, it does look a little different today," to avoid confrontation while keeping them calm. Next, you can try distraction. If they're stuck in a loop, talking about something else can help break the cycle. Bring up a positive topic like their grandchildren or something from their past that will pique their interest. And if distraction doesn't quite work, you can move on to redirection. This means getting them involved in a different activity altogether, like looking through old photo albums, listening to music, or even engaging in a simple task. Activities that engage their long-term memory, like sorting old pictures, can be particularly effective. It's not easy. These behaviors can make you feel overwhelmed. But remember, sometimes the best thing you can do is step away for a moment, take a deep breath, and return with a calmer perspective. There's no perfect solution, but these strategies can make the repetition more manageable for both you and your loved one. Caregivers and family members often share a mix of experiences when it comes to dealing with repetition in their loved ones. Here are a few personal stories that reflect the challenges and approaches they've taken. One lady shared their journey of learning to stop taking their mother's repetitive behavior personally. Initially, the frustration of hearing the same question or story over and over felt like a problem they needed to fix. But with time, they realized that it's not about solving the issue. It's about accepting that their loved one is in a different mental space. This shift in mindset, focusing on their own response rather than trying to change their mother's behavior, allowed them to find peace and treasure the time they had left together. Another caregiver shared how difficult it was to witness their father's dementia intensify after their mother passed away. His repetitive story involved searching for a girlfriend from 60 years ago. Despite taking him to the place where he thought she lived, they couldn't find her, which led to his growing frustration and insistence on walking there by foot. This caregiver struggled to see their father caught in these episodes and expressed the emotional toll it took on them. Yet, they continued to exercise patience and compassion, knowing how deeply his loss and confusion affected him. Another audience mentioned the deep sadness they felt as their once vibrant and funny mother now repeated the same stories about their father's infidelities from decades ago. The caregiver found it emotionally exhausting, admitting that visiting their mother brought stress into their otherwise peaceful life. The mother, now 74, spoke loudly in public, embarrassed her, and fixated on these past events, causing strain on their relationship. In a touching story, a caregiver recalled rare moments when their mother, who struggled with confusion and repetitive thoughts, would suddenly laugh hysterically at her own mixed-up memories. During these precious moments of clarity, both the caregiver and their mother would laugh together, providing a brief, cherished break from the sadness of her declining mental state. These moments reminded them of who their mother really was and helped them hold on to the parts of her that remained. These stories reflect the emotional complexity of caring for loved ones who repeat themselves due to aging or dementia. While frustrating, caregivers often learn to navigate these challenges with patience, humor, and a focus on empathy, finding ways to connect with their loved ones despite the repetition. As our loved ones age, it's common to notice them sleeping more often, especially during the day. While it's normal for seniors to take naps due to lighter nighttime sleep, excessive daytime sleeping could point to deeper issues that require attention. One significant factor behind this behavior can be boredom or lack of engagement. Many elderly individuals find themselves with fewer activities they enjoy due to health limitations. When they don't have much to look forward to, they may fall into the habit of sleeping to pass the time. This isn't always about physical tiredness, but rather a lack of mental and emotional stimulation. Another common cause is medication. As seniors often take multiple prescriptions, side effects like drowsiness can become amplified. Sometimes, simply adjusting the dosage or the timing of their medications in consultation with a doctor can help increase alertness during the day. Depression can also lead to excessive sleep. It's a silent issue among many seniors, and the fatigue that comes with it is often mistaken for normal aging. If your loved one shows signs of disinterest or low energy, it's important to address these with a healthcare provider. In cases where dementia is present, sleep patterns can become disrupted. Dementia affects the brain's ability to regulate the sleep-wake cycle, leading to nighttime restlessness and daytime sleep. Establishing a structured daily routine with meaningful activities can help improve sleep quality. For those with serious medical conditions, an increase in sleep could indicate a change in health status. This doesn't necessarily mean the end of life is near, but it's worth consulting with their doctor to assess their care needs and ensure they are still receiving proper nutrition, hydration, and attention. Ultimately, the key to managing excessive sleep in elderly loved ones is understanding the underlying cause. Whether it's boredom, medication side effects, depression, or health changes, addressing the root issue can help keep them more engaged in life. One heartwarming story came from a caregiver who had been through the journey of dementia with their mother. They noted how their mother's fatigue increased as her Alzheimer's progressed, with naps becoming a common part of her day. What stood out was the beautiful routine they built together, filled with cognitive and physical exercises, morning prayers, and even watching Wheel of Fortune and Jeopardy. It wasn't just about keeping her awake, it was about keeping her engaged in life. Those small moments of connection were cherished, and they made sure her days, even with the naps, were still filled with love. For another caregiver, it was all about finding ways to adapt to the new reality of caring for a loved one who napped a lot. They hired companions to provide some variety and gave their father small tasks to do to keep him from feeling too withdrawn. They reflected on how challenging it is when an elder says they're not bored, but still seems disheartened by how hard life has become. Sometimes they simply don't see the point in engaging, which can be deeply frustrating and saddening for those who care for them. Finally, one audience mentioned how boredom can drive not just seniors, but anyone into more frequent naps. Their elderly friend, in the last stages of his life, would sleep more and more, and occasionally in his sleep he would call out to his deceased wife. It was a reminder that sometimes sleep becomes a place of comfort, where loved ones might feel closer to those they've lost. All these stories remind us that each situation is unique, and the causes of excessive sleeping are varied. Whether it's health-related, emotional, or simply the passage of time, our role is to be there, gently finding ways to support and engage our loved ones in whatever way works for them. As our loved ones age, their skin goes through many changes, and while some issues are simply part of growing older, others might hint at more serious underlying conditions. It's important to stay mindful of the signs so we can support them with timely care. One of the most common concerns is dry skin, known as xerosis, which affects over half of older adults. This dryness happens because the oil and sweat glands become less active with age, making skin prone to itching and cracking. Keeping skin hydrated with gentle soaps, moisturizers, and regular water intake can make a big difference. Bruising is another frequent issue in the elderly. With fragile skin and delicate blood vessels, even the slightest bump can result in extensive bruising. Applying cold compresses and avoiding certain medications like blood thinners can help manage this. Pressure sores or bed sores are a real concern for seniors who spend a lot of time in one position. These painful wounds often develop on areas like the tailbone or heels. Regular repositioning and specialized bedding can help prevent these sores. But if any redness or discomfort arises, it's best to reach out to a doctor before things worsen. Shingles is another condition that impacts older adults, causing a painful rash that lasts for weeks. It's linked to the same virus as chickenpox and can lead to complications like ongoing nerve pain. Thankfully, vaccines like Shingrix can lower the risk. Finally, skin cancer remains a significant concern. It's important to keep an eye on any changes in moles, like size, shape, or color, as these can be warning signs. Regular self-exams and dermatologist visits can help catch skin cancer early. These skin conditions are not just surface-level issues. They can often point to bigger health problems like diabetes, heart disease, or even medication reactions. By staying attentive and acting early, we can ensure our aging loved ones remain as healthy and comfortable as possible. Caring for a loved one's skin can be both challenging and rewarding, and the personal stories shared by others often help us feel less alone in our journeys. Let me tell you about 2 such stories that may resonate with your own experiences. One caregiver recounted the heartbreaking experience of caring for his wife during her battle with pancreatic cancer. As the illness progressed in those final 3 months, her once healthy and radiant skin began to deteriorate rapidly. The treatments, combined with the disease, left her skin fragile, dry, and prone to painful cracks. Despite their best efforts, applying specialized creams and medical-grade moisturizers, the caregiver watched helplessly as her skin grew more delicate with each passing day. The sight of her suffering, not just from the cancer, but from the discomfort of her deteriorating skin, was unbearable. On the brighter side, another caregiver found an unexpected solution for their bedridden mother's severely dry and flaky skin. After trying countless products prescribed by doctors and none offering lasting relief, they decided to experiment with something more natural: pure coconut oil. They applied it after each bath, while her skin was still damp, and within a week, her skin stopped flaking. Within 2 weeks, it felt smoother and more hydrated than it had in months. This small victory became a turning point in their care routine, and the joy of seeing their mother's comfort improve was immeasurable. Coconut oil became a staple, not just for her mother, but also for her caregiver. It's a reminder that sometimes the simplest solutions can make the biggest difference in our loved one's quality of life. Migraines are more than just bad headaches. They are the result of a complex neurological process in the brain. These attacks can range from mild discomfort to debilitating pain, and often come with a host of other symptoms. For caregivers, migraines can be particularly challenging, as the demands of caring for a loved one can make managing their health difficult. Migraines are distinct from regular headaches. According to Dr. Christina Peterson, migraines begin with a prodrome, a warning sign that can appear a day or 2 before the migraine itself. Symptoms might include mood changes, fatigue, or food cravings. Around 20% of migraine sufferers also experience an aura, which can include visual disturbances like flashing lights, blind spots, or even tingling in the limbs. The pain of a migraine is usually moderate to severe and often one-sided, although it can affect both sides. It typically feels like a throbbing or pulsating sensation, and can be aggravated by physical activity, bright lights, loud sounds, or even strong smells. Nausea and vomiting are common, and migraines can last anywhere from 4 to 72 hours, disrupting not just the lives of sufferers, but also their ability to care for others. Certain factors trigger migraines, and caregivers may be particularly prone to these due to stress, irregular schedules, and lack of sleep. Common triggers include dehydration, skipping meals, hormonal changes, and exposure to certain foods or medications. Managing these triggers is crucial for reducing the frequency and severity of attacks. Treatment for migraines ranges from over-the-counter medications to prescription drugs. The key is to act quickly, treating the migraine within the first few hours of onset when the pain is still mild. For those who suffer frequent attacks, preventive measures such as supplements like magnesium, coenzyme Q10 and vitamin B2, or stronger medications like Botox or anti-seizure drugs may be necessary. If you experience migraines frequently or notice that over-the-counter remedies no longer work, it's important to seek medical advice. Migraines left untreated can become chronic. Additionally, symptoms like fever, unexplained weight loss, or sudden severe headaches require immediate medical attention, as they may signal more serious health conditions. Ultimately, managing migraines requires self-care, awareness of triggers, and timely intervention. Caregivers should prioritize their health, ensuring they have a backup plan in place should a migraine strike. One gentleman, Jack, shared the difficult experience of living with migraines for more than 50 years and how these severe headaches have left permanent effects on their brain. After undergoing SPECT and PET scans, they discovered 4 dead spots in their brain, likely caused by the migraines cutting off oxygen to these areas. The damage, particularly in the temporal and frontal lobes, has affected their memory and personality. They expressed deep frustration, stating how migraines don't just cause physical pain, but also alter their identity and ability to function in everyday life. Another story came from Lindaz, who has suffered migraines since she was 4 years old. Now, at 60, she experiences them 3 to 4 times a week. She has tried a variety of treatments over the years, from sumatriptan medications to Botox, vitamin therapy, and antidepressants. However, her migraines continue, triggered by smells like perfume and diesel, temperature changes, air pressure shifts, and stress. Despite the persistent pain, she continues to search for relief, offering blessings to others who understand the same struggle. Finally, Heather shared her long journey of trying different migraine treatments. She initially found hope when doctors suggested the migraines were linked to a heart condition known as a patent foramen oval, a hole in the heart. However, after undergoing surgery to fix the issue, the migraines still continued. For her, maintaining a careful diet, staying hydrated, and ensuring plenty of rest have been crucial in managing the pain. Even so, the migraines remain a significant part of her life, impacting daily routines and activities as she continues to seek effective relief. The thyroid, though small, plays a significant role in our overall health. Situated below the Adam's apple, this gland produces hormones, primarily thyroxine, that manage how our bodies use energy. These hormones influence vital functions like metabolism, heart rate, temperature regulation, and even brain health. When the thyroid malfunctions, it can either produce too little hormone, hypothyroidism, or too much, hyperthyroidism, and both conditions can profoundly affect how we feel. People with hyperthyroidism may experience symptoms like weight gain, fatigue, depression, and a slower heart rate. In contrast, hyperthyroidism often causes weight loss, a racing heart, anxiety, and restlessness. What makes thyroid issues tricky is that these symptoms can often be mistaken for other health problems. It's common for people, especially women, to feel off and not realize their thyroid is the cause. Blood tests that check hormone levels, including T3, T4, and thyroid-stimulating hormone, or TSH, are key to diagnosis. Most thyroid problems stem from autoimmune diseases. Hashimoto's disease is the leading cause of hypothyroidism, where the immune system attacks the thyroid, damaging it. Graves' disease, on the other hand, overstimulates the thyroid, leading to hyperthyroidism. Interestingly, women are more prone to thyroid disorders, and hormonal shifts, like those that happen during pregnancy, can often trigger or worsen these issues. Fortunately, thyroid conditions are usually treatable with medication. For hypothyroidism, levothyroxine, often sold as Synthroid, is prescribed to replace the missing hormones. However, consistency is critical. Patients are advised to take their medication at the same time each day and avoid foods or supplements that could interfere with its absorption, such as calcium or iron. If you or a loved one is struggling with symptoms that could be linked to the thyroid, it's essential to ask your doctor the right questions and stay informed about your medication and treatment options. Thyroid health is complex, but with proper care, many people can manage their condition and lead healthy, active lives. One audience, Marianne, shared the struggles she has had with managing hypothyroidism. After being on medication for years, she wondered if there were natural ways to support thyroid health without relying solely on hormone pills. She is concerned about how the medication might be shutting down her thyroid even more over time. Despite this, she acknowledged that when her thyroid hormone levels are off, she can immediately feel the difference, especially with symptoms like getting cold easily. While the medication helps, she is curious about alternative ways to manage their thyroid and restore balance. As we wrap up today's episode, let's take a moment to reflect on the key takeaways. We've explored common health issues that affect seniors, from migraines and thyroid conditions to skin problems, and discussed how important it is to recognize these signs early on. Being proactive in our approach to caregiving can make all the difference in ensuring our loved ones receive the care they need. Whether it's noticing changes in their behavior, sleep patterns, or physical health, we as caregivers play a vital role in their well-being. But beyond the medical side, it's patience, love, and understanding that truly define caregiving. Caring for seniors isn't just about managing their conditions, it's about creating an environment where they feel supported, valued, and heard. Our loved ones have given us so much over the years, and this is our opportunity to give back, showing them the compassion they deserve in their later years. If today's episode resonated with you, I invite you to subscribe to our channel and leave a review. Your thoughts and feedback mean the world to us, and they help us continue to grow and reach more caregivers. We'd also love to hear your own caregiving stories. Share them with us, and let's build a community of support and shared experiences. Thank you for being part of this journey. This is your host, Rosalie. We'll see you in the next episode.